KwaZulu Natal now because the Road Freight Accident Fund is handing over a newly refurbished rehabilitation ward for road victims at the Clairwood Hospital that's in Durban. The initiative is aimed at improving trauma care and restoring the best possible quality of life for a patient at identified public hospitals. The critical processes of physical rehabilitation is important to ensure that a patient's level of independence is optimized and better clinical outcomes are achieved. Watching this story is SABC News reporter Simphiwe Makhanya, who joins us from Clairwood Hospital in Durban. And Simphiwe, of course, no overstating just how far something like this would go. Tell us a bit more about what prompted the Road Accident Fund to come up with the initiative.
Indeed, Ayanda, you would know that KwaZulu Natal is one of those provinces that record a very high number of road fatalities and also road crashes across the country. And of course, today, the Road Accident Fund is going to be handing over this rehabilitation center, which is actually right behind me. This, of course, is happening at the Clairwood Hospital here in Durban. And we do have with us, Ayanda, the CEO of the Road Accident Fund. That is Mr. Collins Letswalo, going to talk to us about this particular project. Thank you so much for your time, CEO. Thank you. Can you explain to us the rationale behind this work that you're unveiling here today?
Look, most of the time we keep on talking about 14,000 people or 12,000 people that get injured each year, die every year on our roads. We've got about 140,000 of those that get injured. And most of them, people don't see the actual damages that road accident do to those people. So what we are doing currently as the Road Accident Fund is embarking on a program to work with provincial departments of health in different provinces, where we upgrade their rehabilitation centers, but we also do the accident and emergency units that they have, so we rehabilitate them. So we give someone a chance after the injury to be able to live. So in this regard, we are looking at the rehabilitation center, where someone after the injuries and once they've got what we call the acute phase, which is in hospital, once they get out of that, they start the rehabilitation, and that should give them mobility. We are doing what is called physical, psychological, and cognitive rehabilitation in the center.
Talk to us about the process leading up to this. Do departments or the provincial departments of health have to apply to the RAF, or it's you who have to identify such hospitals?
Now we've got an MOU with all the provincial departments. What we then do is that let's choose one of the centers that they have. So we started here. But they are now busy with another rehabilitation hospital in Hillcrest that is going to cover the whole of the KZN province, and we are working together with them on that. We would be announcing very soon on our plans to actually help them refurbish that place and build it to a bigger facility that should be able to take care of the province of KZN. So it's very, very important that our people get rehabilitation as early as possible for their recovery to be the best we can. Under the circumstances, you need to intervene well in time so that the people, for instance, the muscles do shrink if they are not given a certain level of rehabilitation. So we will be giving that rehabilitation to the people of KZN.
How much has been spent on this project?
Well, we spend about, I think it's about 5 million on this project, but we are expecting to be spending more on the Hillcrest facility.
Let's talk about the financial situation that the RAF is currently in. There are reports, of course, that the institution is struggling when it comes to the issue of settling the backlog that it is dealing with. How dire is the financial situation of the RAF as we speak?
No, there's no dire situation in the RAF. We don't understand what people say. What we are saying is that we would love to have more money, but with the money that we have, we are able to cope. Remember that we are paying people 180 days, and we are not owing people above 180 days. That is the reason why we keep on saying that people must actually look at our financials. Our financials must tell you a story. Yes, in the past, we used to struggle with the funds, but so far we are doing well.
Thank you so much for your time.
Thank you.
That is the CEO of the Road Accident Fund, that is Mr. Collins Letswalo, giving us details, Ayanda, about this particular project that the RAF has embarked upon, ensuring that, of course, accident victims do get that necessary, help when it comes to, the rehabilitation. And of course, this institution behind me at the Clairwood Hospital is going to be doing just that, Ayanda.
All right, Simphiwe Makhanya, live to us there from Clairwood Hospital in Durban. We'll keep watching that story with you, but for now, Thanks very much indeed.